to having this be an official meeting, but for now, this is an informational meeting. And I now call to order at 12:06 p.m. The informational meeting of the Strategy Committee, and welcome everyone. Firstly, let's see. Can we do a roll call of who is in attendance? Is that appropriate, Marcin?
Yes, Mr. Chair, but before we do that, I'm just going to mention that it is requested that participants introduce themselves every time they speak. This meeting is also being recorded for minute-taking purposes, as well as for posting of the recording of the proceedings on the agency's website. This meeting is also being live streamed on the Access Health CT website. Roll call for attendance: Steven Hernandez, Chair.
Present.
Thank you. Grant Ritter, Paul Philpott, Paul Lombardo, Matthew Brockman, and Becky Jacobson on behalf of Kathleen Holt.
Yes, good morning, President.
Good morning, thank you. That concludes the roll call for attendance, Mr. Chair.
That's great. And is there any public comment of note?
We did not receive any public comments, Mr. Chair.
Great.
So
and now we are going to postpone the meeting minutes for now. And we will move directly to the strategic project updates.
All right, good afternoon, everyone. I'm Marquise Davis, Director of IT for Access Health. I'm here to provide an update on 10Clicks, which is focused on modernizing and improving our enrollment systems for the residents of Connecticut. Our goal is to streamline the process, enhance the user experience, and reduce administrative burdens while ensuring better access for our staff and better access to healthcare for our consumers. We have finalized the user experience blueprint, and through our analysis with Nits and Hope, we identified several key challenges that create friction for both consumers and staff. Inconsistency, brand, and tone. Consumers receive a mixed message due to variations in language and terminology across the platform. Silo communications, poor coordination between stakeholders and consumers lead to conflicting delays in information, making the enrollment experience frustrating. Complex plan design. Consumers struggle with understanding and comparing plans due to the overlaying detail and confusing information. Burden of income verification. The current process places a significant burden on applicants, creating unnecessary delays and roadblocks. Inefficiency in notice statuses and updates. Hard-coded, non-contextual notices lack urgency and clarity, leaving consumers uncertain about their next steps. To address these challenges, we've structured our modernization efforts into six key tactical areas: user experience, redesigning the application to be shorter, smarter, and more flexible; language clarity and accessibility; standardizing terminology with a uniform glossary, improving readability, ensuring consistent consumer-friendly tone across all communications; notice and status communication updates; overhauling our notice strategy; integrating real-time text and email updates; and making notices clearer, more actionable, and user-friendly; verification and account management; and streamlining identity verification; repopulating consumer data to simplify the account management process; and reducing log-on related issues. Plan comparison and selecting plans. We're going to be enhancing the shopping experience by making plan comparison clearer and more personalized to the user's needs. External enablers and connectors, defining the roles and responsibility of third-party partners, improving the coordination with those partners, and rolling out updates in a well-constructed and communicative manner. Our recommendations focus on immediately high-impact improvements while working with external connectors and partners like DSS to continue to lay the groundwork for a more advanced consumer enrollment process. Revisiting brand guidelines to align tone and terminology across all communication channels. Auditing and redefining notices to improve clarity and urgency and engagement. improving the tax application experience with smarter workflows, filtering experiences for users and with a more intuitive interface. Enhancing the call center experience by equipping representatives with better tools, standardized messaging to assist our consumers effectively. And of course, leveraging technology to enable self-services capability, allowing users and consumers to resolve issues independently without additional delay. We're committed to making these enrollment experiences simpler, more transparent, more accessible for all consumers, and giving our staff the tools that they need in order to support that experience. This initiative will not just only reduce administrative burden for the residents of Connecticut, but it will also continue to build trust and confidence for Access Health. Thank you for your time.
Thank you for that. And, I think the key here is trust and confidence. And given, I think, so much ongoing, at least messaging disruption, fear, and potential further disruption of our mission, I think it's critically important that our hubs, our communication strategy be where people come to feel informed and empowered, and also like they're getting the best information that they can and supported.
Absolutely.
So I really appreciate all these efforts. Thank you.
Thank you.
I think unless there are any observations or further questions, we can move to the next update.
Thank you. Hello, I'm Katie Hurd. I'm the Associate Director of the EPMO, and I'm filling in today with an update on our call center vendor selection. Access Health Connecticut has awarded the call center services contract to our current call center vendor, T-Tech Government Solutions, LLC. We have informed the other call center service respondents that they were not selected as Access Health's call center vendor. T-Tech's committed to providing additional enhancements and value-added services, and we are working with T-Tech now on a transition plan to execute these enhancements. Some of the improvements we're looking forward to include automated authentication of the customer, making a real-time language translation tool available in multiple languages, and having an SMS channel for call center agents to text consumers links and messages. The Director of Operations, Gina Walsh, will keep this committee updated on all upcoming enhancements. Thank you.
Thank you so much. Are there any other observations or updates related to the call center? Well, thank you. It's good to see this continuity of purpose and the enhancements that you're planning as well. So we appreciate the update. Thank you. Next, we have an update on ICHRA.
Good afternoon, everybody. John Carbone, Director of Small Group Broker Support and Product Development. As many of you know, over the past 8 to 10 months, we've been working on our individual coverage health reimbursement arrangement platform with our vendor Newfields Technology. And we're happy to say we've made incredible progress on having the platform be live, establishing it, getting our beta site up and running for our test brokers to start working on it, kicking it around to making sure that the journey for the application for the employer, the employees is seamless, easy to understand, but able to find all the information they're needing. Over the next 7 days, we're going to be in the city evaluating all these other aspects of our new version of our platform, because we have evolved it. Once again, we're receiving all the feedback from our brokers and some of the test employers that we've ran through the system, and we've done version 2.0 of this platform. With that being said, I'm very happy in the next couple of weeks to be able to share it with everybody on this committee, our board, our key stakeholders, and some of our elected officials. So stay tuned on that information. Also, over the past couple of months, We've been talking to our elected officials and key stakeholders regarding this product and sending out brochures and informations. We will share some of that, those brochures and informations with this committee, but we've received some positive feedback on that. We're excited about the creativity, but the conversations that we're having with some new clients, some new brokers, some new constituents that wouldn't kind of play in this arena, and we're getting some great feedback. We're continuing to evolve the platform. This platform will be worked on nonstop. We won't stop. The great part about this, it is a cloud-based platform, so we'll be able to make those adjustments quickly and be able to update things where we feel that if they're effective and efficient and they're easier for the employer and the employee to enroll in either an ICHRA plan, an individual plan, or a small group plan, we're going to continue to make those improvements. We feel that this is going to give their Connecticut residents a different type of option that's probably hasn't been in the marketplace. And we feel like it's going to, once we get past all the terminology, the complexity of it, we're going to feel like it is going to be a good resource for our Connecticut residents. So stay tuned. I'll be providing you all that information. I'm looking forward to being able to give you guys a demo of the entire platform and website. Thank you, Steve.
That's great. Thank you, John. And we look forward to that.
Excellent, sir. You're welcome.
And now, Catherine, I think you're back and you're going to provide for us an update on open enrollment. Is that right?
That's correct. Thank you very much.
Great. Thank you.
Again, Katie Hearn, Associate Director of the EPMO. And I have a brief open enrollment update for you today. You may already be aware of our OE enrollment numbers, but the numbers I'm presenting today are our enrollment numbers from the end of the OE period. We're pleased to report that our qualified health plan retention rate for this OE was approximately 88%. And the numbers that we have below that, the second bullet point there, were our forecasted numbers that they were shared with the board in November. So just there for reference, this is where we were at the start of open enrollment. We did exceed our forecasted numbers. Next slide, please. Included here for your reference are the baseline enrollment numbers for OE12. This was as of the 1st of November. So you can see exactly how much enrollments grew over the most recent OE period. And the actual numbers are on the next slide. As noted, our retention of customers year over year has been a key contributor to our record enrollments during OE12. In all, 151,151 consumers enrolled in qualified health plans. That's including Covered Connecticut at the conclusion of OE. And Covered Connecticut alone saw a 50% increase year over year. Finally, at the bottom there, our dental enrollments increased by 26% at the end of the OE period. So very successful. We have our challenges, but it was a very successful open enrollment. Thank you.
What were your, I'm sorry, and you may have noted this, but I missed it if you did. What were your goal? What was your goal, your target goal for 88% sounds amazing, but did that meet, exceed, or come shy of your target role for open enrollment and for getting the transfers over?
Sure, I'm happy to get that for you.
Yeah.
Yeah, and I don't know the retention rate from last OE. I'm happy to get that, and also get how many customers we thought we would retain.
That's great. That's great. I think it's just important to be able to track and talk about that, because it'll help show whether our strategies are working. I know that this has been such an engaged effort by the exchange, and I'm glad to see that effort has been there. And I think that you have very likely not only met but exceeded. But of course, it's important to track it and then be transparent about where we are. So thank you for that, and we look forward to receiving that information.
Thank you.
Thank you. And I think, Susan, you're going to be giving us an update on Health Plan Benefits and Qualifications Advisory Committee.
Yes, I am. Thank you, Mr. Chair. Susan Rich-By, Director of Legal and Governmental Affairs at Access Health. I also have the pleasure of leading the plan management team as well. And that is the team that works very closely with the Health Plan Benefits and Qualifications Advisory Committee. So we are working on our plan year 2026 certification requirements, including the standard plan designs that we do each year. Several meetings have been held at this point, with one more scheduled for next week for the final recommendation that is needed, so that we will have the full slate of standard plans to recommend to the board at the meeting scheduled in early March. The standard plan designs, just to remember, have to meet the actuarial value ranges set by the ACA for each tier, silver, bronze, gold. And the carriers also have to be able to comply with federal mental health parity requirements for each plan design. And that is actually a test that is done using their own data. So we have an outside actuarial firm, Wakely, who assists us on this process, and they do projected testing for the plans using the data they have in their they have an ACA database, and they use regional New England data, but the carriers have to actually be able to pass using their own data, both AV and mental health parity. So the plan management team and Wakely this year evaluated our current plan designs of 2025 plans, utilizing the new calculator that CMS put out for plan year 2026. And the plan design, we learned that plan design changes would be required for many of our current standard plans. The AV changes result from CMS updates that they make each year to the AV calculator, which trends underlying claims data forward in the tool for 2026. Plan management this year also conducted research comparing plan options offered through other state-based exchange and also through the states participating on the FFM to look at other standard benefit designs and cost sharing. As a result, we had multiple plan options that we developed and worked with Wakely and presented to the carriers for their evaluation and testing, and then also for the committee to compare which direction they wanted to go. If the plan doesn't meet, you have to change something in the benefit design, whether it's cost sharing for a specific benefit or the deductible or the maximum out of pocket, so there are a number of different levers that they can look at, and the benefits have different sensitivity in the calculator. So you have to look at a lot of different options. The plan management department also, just to note, works out the schedule because the goal is to have the standard plan designs approved by the board in as early as we can in March, so that we can put out our annual solicitation to the carriers, so that gives them enough time to do the work they need to do on their end, creating plans and rates, because they have to meet the June 1st filing deadline. And that deadline is for Access Health, as well as for the insurance department, who does all the review of the benefits and the rates. Access Health does not approve the rates. So that is where we are. So we're hoping to wrap up next week, and then we'll be presenting all of this to the board very shortly. So I will pause if there are any questions.
None from me. Any questions or observations? Anyone else on the call?
And the goal, obviously, everyone, reads in the media and looks that everything gets more expensive, and the benefits. So our goal is always to try to not to keep as many services as possible in the standard plans before the deductible, to make sure that they are accessible for people, primary care, specialist visits, certainly generic drugs on the 4 tiers of the prescription drug coverage, labs, x-rays. We really try to keep as much as we can, without also keeping in mind that the more that you do that, you drive the premium up. So it's always a balancing act of making the benefits accessible and trying to keep the premium controlled, if you will.
I wonder if we might segue into the next portion of your update, which is the,
perfect. Yes, perfect segue, talking about premium. So And James apologizes. He was unable to attend today. He was going to give you this update. So as everybody hopefully is aware, the enhanced subsidies that have been in place since 2021, originally through the American Rescue Plan Act, and then extended in 2022 through the Inflation Reduction Act, through this current plan year, are slated to expire at the end of this year, and Congress will need to take action if they are to be extended past 2025. We have been working on this for a very long time. We are very active with the other state exchanges through a group, and we've been following and tracking this and working on this quite closely. And you may have seen in the media, we are trying to get the word out as much as we can to all of the various stakeholders and also to the public, importantly, because this is kind of something that maybe people, inside the healthcare arena maybe are aware of, but consumers out there maybe not be aware of and don't even realize that they're, receiving the benefit of an enhanced subsidy. What these enhanced subsidies have done is it's taken away the cap at 400% of the federal poverty level and instead changed the whole contribution table, moved it lower, starting at 0 instead of 2% for those of lower income, and then capping it at 8.5%. So depending on someone's income, at some point an income becomes too high to be eligible for a subsidy, but there's no automatic cap that cuts that off. And this has really made a huge impact, and we can see this in our expansion of coverage over the last several years for people that were previously not eligible for subsidy at all, and just making the subsidies richer across the board. And it was also a big part of allowing the state of Connecticut to create the Covered Connecticut program for consumers up to 175% of the federal poverty level. So if they are not continued, it will increase costs for everybody across the board. It will increase the state's cost and the feds for Covered Connecticut. And the other piece that's tied into that is as premiums go up, you may lose some younger, healthier people. And we've actually seen tremendous growth in our younger enrollees over the last several years. As enrollment has grown, we've seen a lot of growth in younger ages, which is really terrific for the risk pool. And the fear is that if the premium subsidies, the enhanced subsidies go away, people will really have to look and decide whether they can afford coverage, and you wind up having more older, sicker people being the ones that are going to retain coverage, and other people may decide to do without, and which will drive up premiums across the board because you see a worsening in the risk pool. So it's something we're actively working on. And we also, if they do not get extended, we will be doing a big campaign. Caroline and her team are working on that already for consumers for the next OE and messaging, around premium. So everybody is very aware, and we're just doing everything we can.
That's great. Thank you, Susan. And when you think about having a relationship with your health, and of course with your healthcare providers, that is not only a reactive relationship, but a preventive one as well. And
Correct.
So much of the strategy of transitioning from what may have been your coverage in your youth to coverage in young adulthood is that strategy of being invested in your own health and in prevention. So thank you for noting the importance of having young people in the pool, both on a practical level, but also as a matter of public health. And having young people understand that they have a role, a very active role, in building good prevention practices through investment in their coverage.
Yes, and as anyone knows, anything can happen to anybody at any time. So yeah, so it's vitally important. So
that's great.
We shall see what happens.
That's great. Well, thank you for that. And in terms of speaking of agency, speaking of being engaged, speaking of taking an active role in extending some of this coverage and opportunity to community, I think we're going to move now to our Broker Academy update. Is that right?
Wow, I'm honored for that introduction. Thank you so much. Sorry for the glare. I'm in my office and I can't quite shake sun.
Quite all right.
Good afternoon, everyone. Tammy Hendricks, Director of Health Equity and Outreach Department. I have some Broker Academy updates for you all. We are going into year 4. I cannot believe it. Feels like we just started it last year. Right now, we are in the middle of recruiting, really promoting the program at all of our events. We're doing a lot of presentation for community partners at community colleges, different organizations that request it, that may have groups interested in applying. Right now, we're up from 91. We do have 184 leads from our website. So significant jump there, or about doubled. And these are individuals who are interested in applying. We did add a form on the website a couple years ago, and it's taken some time, but really picked up. A lot of people are completing that form, stating that they're interested in applying to the program. We've also seen an increase in traffic as well. So traffic for last month was over 500 folks visiting the Broker Academy webpage. So we're happy to see that number continue to grow. So quick updates on the actual program details. The applications are set to open. The application is set to open on March 1st, same as last year. It will stay open for the entire month. We can accommodate up to 100 students, as with previous years. This is just a good number for our staff to be able to give each student the time that they need and the help that they need to get through the program. We are going to have 2 class locations as before. We are still trying to finalize the locations. We did get a verbal commitment from a community partner that would allow us to use their space for the class days, which would be fantastic, saving us some dollars, but also having a familiar place in the community for students to go to would be great. So once that's finalized, we'll make an official announcement. This community partner, they have locations in high need, underserved areas of the state, and they have locations that are very easily accessible, which we always look for. So we are looking forward to that partnership. We did add an extra week to the program readiness portion of the program. These are the weekly meetings that we hold for students to get them prepared for the actual in-person class days. We've seen over the years how important these are, so we did add an extra week for that. We made a slight adjustment to the in-person class schedule. We did add more structure to the pre-training weeks, right? Getting the students ready, getting them through the materials. They will have access to an instructor with during the pre-training classes as well. So we did cut the in-person class days down to 2, and we're really going to focus in on the state exam and prepping the students for the state exam during those 2 days. And it will be on the weekend, so that really will free up a lot of time for students who work full-time. Last year, the previous years, we've done it during the week, which is hard for some people. And so we're hoping that the weekend will be more accommodating for the typical population that comes through this program. And so 2 days, they'll have over a month to complete all the course materials before they actually come in person, and then we'll get them that in-person help to really study for the state exam and get them prepared for that. And I think we've added, previously we've added additional time for the mentorship that will stay the same this year. So I'll pause here for any questions. I know I just...
Well, thank you. And the only thing that comes to mind is, or at least a question that comes to mind, I see that your locations are to be announced. Are those determined based on where you find the interest in a particular class cohort?
Yes, a few things. So we look at the website traffic. We
Yep.
look at how the locations of where the students are coming in from after they fill out the form. So we look at
Great.
those locations. And we also get feedback from the previous class and community partners. So community partners typically send us a lot of the candidates that come through. So we go by feedback from community partners. So we're getting input from a few places before we make the decision on the locations. And of course, it's really hard to narrow it down to 2, but we try our best to meet the needs of the students, the past students, the current students that want to come through the program, past students, and community feedback. And then we kind of take it from there.
That's great. Thank you for that. And then finally, the 100 students that you accept, is that 100 over the both locations, 100 at each location? How does that work?
100 total. So
Got it.
typically
Perfect.
typically we try to split it up 50-50
Yep.
would be the max that we can reasonably accommodate.
That's great.
Yeah.
That's great. And what this shows, I mean, that level of intentionality in terms of having a limited discrete cohort and then setting up not only a location, but also a spread that is fair to both sides. It really shows that you want this to be an experience that isn't necessarily personalized, but it's tailored to learning and it's tailored to really bringing the best experience to the cohort. So we really appreciate that and enjoyed your update. Thank you.
Thank you so much.
Great. And I think, Marcin, seeing no other business before us and the fact that this was an informational meeting, I would then ask that we at almost 12:40 in the afternoon on Friday, February 14th, that we adjourn. Happy Valentine's Day for those who celebrate, and we'll see you soon.
Thank you.
Thank you.
Thank you, Mr. Chair.
Thank you,
Great.
Mr. Chair. Thanks, everybody.
Thank you.